Hi friends, this is the Be Real Babe podcast, a place where your average Canadian wolfpack come together to talk about life stresses, messes, and successes. A safe space where being yourself is the ultimate goal. Each week we will bring you new episodes sharing our opinions on a ton of different topics in hopes we can get a better understanding of ourselves, each other, and this crazy world we live in. We want to build a community where we can show up as ourselves, be real, and lay it all out there. By sharing our opinions and experiences, we hope to reach others who can relate so we can all help each other learn, grow, and heal. But please keep in mind, as a disclaimer, none of us here are professionals, no one is giving any advice. We are strictly speaking of our life experiences, our opinions, and for entertainment purposes only. Now, with that being said, it's time. So grab your drink, grab your joint, and let's jump right in. Welcome, everyone. Welcome to Being Real With. This is a part of the Be Real Babe podcast where we get back to our roots and we talk to our friends, family, community about their experiences, their opinions, and whatever we want. For those that don't know me, my name is Brandy. I am the host of the show, and today, you guys, we're on a very special episode. It's episode 143, and it is our last guest episode of season 5. I'm equally excited and sad at the same time because I'm going to miss talking to people for like a month. Y'all, I love talking. But anyways, today, you guys, we have Being Real with Dr. Jon Kanevsky, and I am so excited, you guys. This lines right up perfectly with the last episode that I had talking about my own personal beauty journey, and this episode was just absolutely fire. I'm so excited for you guys to tune in, but before we do that, I'm going to remind you, if you are listening on YouTube or Rumble, anywhere that you're watching the video, you can make sure to like and subscribe, turn on those notifications so you know when your girls are launching another episode, which we'll be breaking for a little bit soon, but we still got a couple left. And if you are listening on the audio ones like Spotify or Apple, you can as well follow us, turn on those notifications. On Apple, you can even leave us a review if you're feeling spicy, if you feel like sending your babe some love. Really appreciate it. And you can also follow us on social media. Of course, we're on Instagram, Facebook, and Pinterest at the Be Real Babe podcast. Also, you guys, just one last before we get into this episode. If you want your own episode, you want your own Being Real With, you have a topic y'all want us to talk about, make sure to reach out to us on our Instagram. We would love to have you on, love to talk to you. Don't think that your experience is minimal or that no one wants to hear it, because we absolutely do. Now, season 6 is going to be designed a little bit differently, but we're still going to have plenty of space for voices to be heard. So yeah, make sure you hit us up if you want to come on the show. Other than that, let's get on to the show. Okay, babes, it's time to get on the show. And today in studio, we have a very special guest joining us from Beverly Hills. I have with me today Dr. Jon Kanevsky. Hello, Dr. K. How are you doing today?
I'm doing great. Thanks for having me on.
Oh, thank you so much for coming and agreeing to come on the show and just being real with us today. I'm so excited.
Yeah, it's my great pleasure.
So before we get on to the show, can you tell our community a little bit about yourself, what you do in your life and your work, whatever you feel good?
Sure, yeah. I am, so like you said, I'm from Beverly Hills. I am a board certified plastic and reconstructive surgeon, and my practice is focused solely on breast explant as well as breast reconstruction using fat transfer. And I use a newer methodology where I move tissue around the body. So I move fat around the body while patients are awake and comfortable, and using a special technique that I've developed over the years to really honor the process of transformation, treating surgery as a ceremony.
That is really cool. That's a whole different level and kind of like your own little space that you have there. I've seen your pages full of a lot of spirituality and stuff too, and I think that's really
Mm.
what drew me to that, because it's a very beautiful. It's not to be this way, but it's kind of taking the focus off the corporate business part of it and really focusing on the individual and helping them through that journey. I'm going to say a little bit more holistically and fully rounded than just coming in
Mm-hmm.
surgery kind of go thing, that's really amazing. So that's awesome. How long have you been doing this for, like surgery in general?
So I've been a plastic and reconstructive surgeon for almost about 10 years now. I completed my training in Canada. I'm doing a residency focused specifically on plastic and reconstructive surgery. I've been in private practice and um, working in the specific area of aesthetic and reconstructive surgery for the past 3, 4 years now,
That's really cool.
and been doing the minimally invasive body sculpting and explant stuff for about the past 5, 6 years.
And what drew you initially to doing this, and then was it something that as you got into it, you kind of veered off into a different direction? Is there something that kind of, can you explain us like your little journey in that, not little, your journey
Yeah,
through
no,
that?
no, totally. The journey can be as big or small as you
Yeah.
want to, but yeah, it started at in my last year of training during fellowship. I started to notice more and more patients coming in with concerns about their implants, and this is around a time where it wasn't widely accepted, or the term BII, breast implant illness, or problems around implants weren't I would say wouldn't have the traction they do have today.
Yeah.
About 6, 7 years ago, there were rumblings of it in the community, um, but I was noticing a significant number of patients coming in saying, I think my implants are making me sick. And I would listen to patients and you know, going the sort of traditional medical route is to look up evidence and to try and understand. And I would always have the heart and time for my patients, but I just couldn't find any evidence that either supported or was going against what they were saying. Even though back in the 90s there was this issue with breast implant illness, it was called something else at the time, but there was a concern around it. But regardless, even though I couldn't find any good evidence for it, I was still listening to my patients' concerns, and I was noticing this. They say if you see something once, it could just be a coincidence, but if it
Yes.
starts to repeat a second or third time, there's a pattern. And I was seeing it enough that I was like,
Something's
there's
up.
something going on here.
Yeah.
So I personally decided to stop doing any breast implant surgery altogether, until I could safely say or have some good ideas around who would be likely to develop the symptoms from breast implant illness.
Fair.
That was 5 years ago. Um, I will, um, yeah, I'll never forget the last time I put an implant in. I was like, no more. It was for there's still a place and setting
Of course.
for breast implant reconstruction for
Totally.
patients who've undergone um, breast cancer treatment,
Mhm.
but I was very happy to step away from breast implants altogether and focus more on developing and improving techniques in surgery that would help people without the use of implants.
Yes, that's
Um,
incredible.
yeah, and just really listening to not just the patients, but I've had a lot of friends and a lot of friends reach out to me saying, I think my implants are making me sick, or this is what I feel after I've had the implants in for a few years. And I was just noticing this really powerful physical and psychological shift that people would go through.
Totally.
That the implants themselves were sort of like encapsulating a memory or part of life that they no longer identify with.
Yes.
That was more the psychological side, but then also the physical symptoms, um, which I'm sure many people have heard of, you've heard of, but we're really creating like an autoimmune like state.
Hmm.
So like an overactive immune system causing all sorts of symptoms, everything from joint pain to hair loss to fatigue to dry eyes, and um, just just really making people's lives miserable. So stepping away from the implants and then focusing more on fat grafting as a safe alternative was really the transition for me. And I knew when I was doing stepping away from implants, it was really clear that in the industry there's surgeons who will put implants in. There are surgeons who will take implants out. Some surgeons who do both, which is, I think, a little bit confusing depending on
It's a little misaligned, but
which, yeah. But the perspective I had is, as long as there's surgeons putting them in, there's going to be surgeons who are taking them out, and you're just on kind of either side of an equation. And what really should shift is the equation altogether, which is there should just be a better, safer alternative, which is using your own natural fat
yes.
to change and to do that kind of procedure, whether it's for reconstruction or for an aesthetic augmentation.
Yeah, that's incredible. So I want to go back so many good things. I'm going to try and get through all of them. One, thank you. This is far more than I even knew existed. Just because I've been on the, like you said, I've done so many. I think we're at like 8 episodes with BII survivors, and that all started
Mm,
because a couple years ago, I've always had that. Told, especially in the fitness industry, like, oh, get breast implants, and people just said it's so easy, like it's such a minor easy thing to do, and I'm just a freak of nature, and like the thought of going for
mm,
surgery is just not something that I'm like, yeah, let's do. That scares me. And so I've always had this obviously issue. And I've had Dr. Amanda Brown on, talking about that.
She's awesome.
She's amazing, absolutely amazing. I bought her
Yeah.
book and I was actually able to gift it to a friend here locally that was going through an explant and having a hard time. I was like, hey, by the way, I have this book that I bought that I don't really need,
So
but
funny. I literally have
yes,
it right here on
there
my
you go,
desk.
busting free. Yes. And so I had started it because I just wanted to read just for myself and also for, my future guests and anybody. And then a local girlfriend who I just admire so much, we work together. She was having a hard time, but she was sharing it on her story. And I was like, hey, I have the perfect book for you. Can I drop it off for you and you take it as you need it? And it was just kind of like a full circle moment. But, anyways, what I find a lot, like you said, is that people have a lot of these symptoms that are so wide ranging. And I find that a lot of the women that come on the show have told me that they equate it to something else in their life, like being a mom or being in the fitness industry. And, like, because all of those things that you list are also symptoms of a lot of other things. And because,
Hmm.
like you said, up until the last couple of years, BII was not captured and talked about, they just equate it to all other things. And they go back to their surgeon and be like, hey, this is a problem. And they were gaslit to say, no, 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 it's in your head. It's anxiety. It's from other things. But 95% of the girls that have come on the show, about 8 to 9 of them, and I've had explant, says like 90% of their symptoms clear up like almost immediate. And some of them are long lasting because of how long they had
Hmm.
them, or maybe they are still on birth control or doing things that are maybe just like not able to support their immune system coming back. But it kind of blows my mind. And I appreciate so much individuals like yourself and Dr. Amanda that are not gaslighting people when they're saying, hey, okay, there might not be studies for this, but I'm hearing you. So, like, thank you very much for listening, because if something, in my opinion, if something's not going to make money, really, why is someone going to invest in those studies? Is that fair to, like,
Hmm.
that's kind of how where my thoughts are, right? Like, I feel like money, it's the same thing I feel like with cannabis industry. It doesn't get put money into it because it's going to affect another industry, right? That's kind of, unfortunately, kind of how I've seen some things. And I feel like that's the same with this too.
Yeah, no, and you make a great point about research in general. I would say in this particular industry recently, and I'm grateful that there's been a resurgence of research in BII. There have been many dedicated plastic surgeons I know that are really adamant about finding and understanding. In
Yes.
fact, there was a plastic surgeon who did one of the larger studies that
Good.
sort of uncovered like the real link. Um, but research can be a really complicated space sometimes. And in the 90s, when the original implant moratorium happened, when there was a complete stop on all silicone implants, there was a ton of research that was done that was heavily funded by industry. And it's no surprise that it showed that there was no clear link, and that I think if anything, with the way that research is done, the most important thing is to have a really critical eye and understand
Mm.
how research is being performed. Some basic statistics are always helpful to understand, meaning like how are these studies powered, meaning are there enough participants in the study to make sure that the results are actually meaningful and significant,
Mhm.
and how are they funded, because that makes a difference. Are they disclosing any conflicts of interest in funding?
Yeah.
That kind of critical thinking around research is always really helpful, especially nowadays, because you can basically find just about any research paper to support an opinion.
Yes.
And I've gone through this with BAI. There's a lot of research out there that shows that there's no link, and there's a lot of research that shows that there is a link. My background in immunology, my before I studied medicine, I studied immunology. That was my first degree. Um, the basics a basic understanding I have about immunology in theory really does point to there being a very logical sort of progression as to how silicone implanted in the body can cause these
Mhm.
problems. So um, just a little bit about the sort of biology of it is that silicone acts in the body, any foreign body that's put inside anywhere in the body is going to elicit something called a foreign body reaction. So the body's going to create this capsule around it. Silicone specifically can create an adjuvant reaction, which is something that's put in vaccines, but it basically kind of triggers the immune system. It causes the immune system to go a little bit overboard. And what we know is that patients that have a predisposition to autoimmune conditions, whether it's like eczema, dermatitis, asthma, allergies, anything that kind of is reflective of an overactive immune system,
Mhm.
they're likely going to have um, a
Response.
stronger reaction or yeah, an immediate reaction to the implants. And I've also noticed too, I always counsel and coach my patients through the process of doing the explant. Is that, I can't guarantee, and removing of the implants does not guarantee that the symptoms will go away. It's only happened once in my memory, but where it felt like the patient felt like some of the symptoms did not improve. But for the most part, removing the implant, removing the capsule, patients do feel a lot better. Now, whether it's like the scientific evidence behind it, or it's anecdotal on a patient by patient basis, it's just clear that there's a really strong link to how patients feel about the implants, and how the body reacts to them. And one other important thing that you said is, along the lines of the work that Dr. Brown's doing, and all of these clinicians and healthcare professionals coming out and just supporting patients, I think is so important, just because
Very,
the
very
medical
true.
industry has been gaslighting women for a long time and not acknowledging, this is not just a random blip.
No.
And even my own training, as unfortunate as it was, I would hear surgeons totally just belittling patients, not to their face, but just like out in
But
conversations, be like, "Oh, I
yeah.
think these patients are just making it up. These symptoms don't make any sense." And unfortunately, that's kind of the way the medical industry is a lot of the time, just because, and it's not necessarily to say that doctors are the problem or at fault or anybody. It's just that, like, whenever there's something really new and that people don't fully understand, they're going to fall back on their training and the thing
Yeah.
that they understand the most.
Yes.
Otherwise, you would just have a bunch of healthcare professionals constantly in this, like, in this state, in the ether,
Yeah.
accepting every possible
Everything.
question and diagnosis.
Yeah.
Yeah, and then it just wouldn't have any kind of
That's
grounding. So
missing
it's
too.
it's
Yeah. There's got
that
to be a
is,
balance.
yeah,
Yeah.
yeah, and I'm not defending the doctors that I gaslit women. I mean, myself, I was like, right away, I was like, this is
This
strange.
is,
Like, to have like three patients come in the same day with questions about their implants, is that there's a signal there. So I was immediately, my alarms were going off. But just to say that I have this understanding, it's like, yeah, it's like they don't, if they're gonna, if a healthcare professional is trained to just like look for the evidence, there's not going to be any evidence, because this is a new thing that people don't fully understand well enough, and it's not fully accepted. So, and unless they're going to be so motivated to go and do the research, it's going to be stuck in this limbo. And
yes.
often it's easier to just stick with what you know. So although that being said, I definitely agree with you. I think the medical industry has gaslit women for a long time, and it's time for it to
Yes.
stop. And it's great that there's so much support, not just among healthcare professionals, but also among patients in the community. There's
Yes.
great groups out there. Your podcast is doing an amazing job, just like bringing these stories to light so people are aware. Because I'm still shocked that breast implant surgery is, I think it's still the number two most popular plastic
Yes.
surgery procedure. Yeah.
Yes.
For a
And
while it was number one. It fell down to number two recently because fat transfer and liposuction is becoming more popular.
yeah,
But it's just like, man, every,
I think
every time I look at those stats, it's
it's
like 100,
hard. Yeah.
it's like
We did.
100 to 200,000 a year. Just like, my God, that's like, if even if only 2 to 3% of those patients develop PI, which is likely, we know statistically likely more.
Yep.
I mean, that's a lot of people every year that are just were either not properly informed, didn't get proper informed consent, and now have to deal
Live
with
with
the
it.
the aftermath.
Yes.
Yeah.
And I think my biggest thing is that's what I've heard all the time is like I didn't know. And for the most part, most of these girls that I've spoken to, these are women from my life to women that I've met online just by speaking out against it because, I'm not going to be I'm high school educated. I'm not a doctor by any means. And I think that's a lot of people can sit back and agree with me where you sit back and you're like, even though I'm not educated, I'm not dumb and I can see trends and I can see patterns. I'm an observant person and I'm an empath. So I feel what these
Mm,
women are saying to me because I also got gaslit about birth control and was told that, this is all in your head. You're a teenager. Don't worry about it. And instead of getting to root cause of why I was like dying of pain, they're like, here's some Tylenol 3 at 16. And then that started a whole prescription drug addiction at 16 years old because, wow, it took my period pain away, but it took all of the pain away. And the doctor says it's okay and he's giving it to me. So it must be okay. And, as a 36-year-old, I'm barely taking Advil now because I'm like, hell no, get away from me. You're the devil. But I think a lot of us have that kind of medical gaslit moment, whether it was, a plastic surgery or medication or something, and it kind of like burns this fuel inside of you that you have to help other people then understand and know what happened to you. And I think that's the biggest part of our show is like, we don't have the research and the receipts medically, but we're going to show you all of these experiences. So say you're sitting at home and the doctors are saying we don't know what it is, and you've gone through all those testings and you have this massive anxiety and depression, but like you're not sure why, and you have breast implants. I think it's good to know that there could be a chance that you should look into that more. And I think it's fair to raise flags and have questions, but immediately like, well, you're not educated, you're not a doctor, so you don't know. It's like,
Mm,
yeah, but what do you attribute it to then? Like, cool, fine, I'll accept that, but then why? It can't be just all these women are crazy. Like, yeah, we're crazy, I'll admit, but I think for the most part, most human beings aren't supposed to be depressed and anxious and in pain and inflamed and hurt. And so, like you said, if something's getting into your body, that it immediately has that response, and you're predisposed by your genetics, your environment, to not have a good immune system. I think it's very fair to point to those things. Like, soon as someone tells me they're sick and they've gone through all these things, I'm like, do you have any implants by chance? I lose a lot of friends that way.
mm,
I should stop doing
mm,
that, but I just feel like I have to share it because I see it, right? Like, I don't know how else
mm.
to fix it besides opening my big mouth.
I think the way you're doing it by holding space for the discussions and allowing people to, you create the information source that people can come to and
I'm
seek it out.
hoping. I'm hoping.
And I have the same awareness too. I never want anyone to feel ashamed for having implants
Mhm.
or self-conscious for a decision that they made a long time ago that maybe is no longer serving them. So I never approach it with any kind of language or wording or discussion that would make anyone feel anything less than.
Yes.
It's all about just being like, hey, this is, these are the things I've noticed and observed in my medical practice.
Mhm.
They may or may not apply to you, but
Yes.
I'm here as a resource if you have any questions. I've
Yeah.
noticed that the tradition, like in my experience, the arc for timing for an explant is about 3 years.
Hmm. That's very
Meaning from
safe.
like the time that patients either come to me to first start thinking about it, or friends reach out to me to the time that they actually seek out to do the explant is about 3 years.
Yes.
And I think that's actually a good amount of time. I definitely don't think this is the kind of procedure you should rush into, even though I've had patients reach out to me like, I want these out tomorrow. And they've probably been thinking about it for a while, to be fair. But from
Yeah.
the time where you start thinking about it to the time you do it, on average, I'd say it's about 3 years. And excuse me, the reason for that, the reason I think it's good to take the time is because um, it really is a big physical and psychological shift that happens, and you have to have this level. Like, you want to be able to be so sure when you're going into surgery that this is the route you want to go, because your body will change, your breast will look different, and
Yes.
it will be an adjustment.
Yeah.
And it's not the kind of thing you ever want to rush into, and you want to be so in your alignment and so in your integrity when you are in the recovery room after your surgery that you just feel great.
Yes, that's very
And
fair to
that's,
say. There's a big
yeah.
mental, like you said, you got to prepare, and then mentally you got to
Mhm.
prepare too, right? And I know that we're so reactive these days, myself included, especially when you fall down that rabbit hole of learning of all the toxic stuff in your environment and you're eating it, especially when you like quote unquote wake up spiritually and you start looking around and like starting having that fear, it's very easy to get trapped up and like, I need to get it out now because the longer I have it in, the more damage that's doing. But sometimes you really, like you said, you need to prepare your home, your body,
Mm,
your mind for that big decision as well, and making
mm,
sure that it is the correct one. Because and having that mindset of like, if I do get these out, it is rare that people aren't seeing the changes of their side effects, but that could happen, and what does that look like? And I think one of the things that I noticed when I first fell into the BII rabbit hole a couple years ago was a lot of women that were getting their explant, but they weren't getting the cap around it removed because there wasn't as much knowledge around explants, and then they were just removing the implant itself, but then they were still having mass amount of issues after to find out, no, that there's like a, I'm sorry, I'm terrible at the wording of it, like capsule, right, that kind of
yeah,
forms
that's the, yeah.
sometimes, and some women weren't getting that out, and unfortunately there was like a lot of toxicity, I guess, in that, still causing them the same pain. Do you feel
Mm.
like as the years were progressing, more explant doctors are learning of more of those things as well, and it's going in a good direction there?
Yeah, so the research around the capsule is pretty interesting. So in the theory behind the capsule is that that's where a lot of the immune reaction is happening that's causing the
Okay.
body to have this really strong response. So the body creates this sort of container around the implant, which is called a capsule. And the capsule has these different layers, and one of the layers is really rich and full of all these inflammatory cells that are creating the actual shell around the capsule, but is also causing it to some of those inflammatory mediators get into the body and causes the body to react. Now there was just to try and to give to be fair and balanced, there was one research study that was done recently where surgeons were removing the capsule and not removing the capsule, and they were trying to see if there was a difference in terms of patient outcome,
Mhm.
and they showed that there wasn't. Um,
Interesting.
yeah, in my in in my opinion, I still think removing the capsule is important. It was a smaller study, so they didn't do a very large number of patients, but I still I think the what should guide the decision to remove the capsule is what the actual capsule itself looks like when you're
Okay.
doing
Yeah.
the procedure because they don't all look the same.
Yes.
I've taken out some capsules that are rock hard and it just
Mhm.
like you can just feel the texture of it. It just like feels like it's just been sitting in the body, getting thicker and thicker and harder and tougher over time. So there's really a strong immune reaction happening. Um, Whereas other times the capsule is like just this very thin membrane. It's very soft. It doesn't, you look at it and it looks totally normal. Um, I do have a discussion about it with patients, and I will often make the call in surgery unless the patient is determined and adamant to remove the capsule.
Yeah.
Um, from a surgery standpoint, technically it is more challenging to remove the capsule. It does make the surgery more complicated and slightly more dangerous, I would say, just because the way the capsule lays in the body. Um, I think the majority of surgeons who are serious about doing explant, they have to understand how to work with the capsule, and that it's important to
Mhm.
remove it, especially if that's what the patient is wanting.
Yeah, for sure. And I think that's too, it's why it's a good idea to research, just like when you research to get them in, research getting them out, and just, making sure that you're going to a explant surgeon that's going to hear you, right? Because maybe they
Hmm.
have their own ideas, and I think it could be another form of gaslight. I don't know, but that was just this one girl, is that she got them out, and she had said that she was feeling the same. So a couple of months later, she found out from someone else that was like, "Oh, did you get the capsule out?" And she was like, "No, what's that?" And then went back, got it out, and she was better. But what would be the positive of leaving it in? Like, why would, besides the difficulty of, is there like a positive? Like, does taking it out make it form different after?
Um, it's a good question. I would say the main reason to leave the capsule in is it's a much simpler, uh,
Process?
less invasive surgery.
Oh, fair. Okay. That's fair then.
Um, Yeah, you could argue that there's some benefit to leaving it in from like a structural standpoint because the surgeon can then use the capsule to reconstruct some parts of the breast, like on the inside to suspend the breast, but
Yeah.
that's not done very often. I would say
Okay.
just that the number one reason is if not removing the capsule, what that means is the incision can be smaller
Mm.
and the surgery itself technically would be a lot simpler and faster, which would mean less scarring for the breast.
Yeah.
Um, and less overall damage to the tissue inside.
That would make sense. And do you
Yeah.
find, so you've done this for the last 5 years, do you see an increase in explants over the years as, breast implant illness? Like I said, I fell down that 5 years ago, just looking at a hashtag. I was like, what is this? And I was like, what the fuck? It was kind of my like, and I was trapped by months. And I literally went to every single girl I knew that, no, terrible. I am so sorry, friends. But I just like started hype because I knew that any day that I would get that 10 grand, I would be that. It was more the gym. I'm more of a gym rat now. So the thought of, having that
Mm,
impede my chest workouts is where I'd stop
mm,
now. But I was one of those people, and I was like, I'm so glad that I found this. I'm so grateful for these women for speaking out. This is why I like to have them on my show and share, because
mm,
they saved me. Because I even had like barely could have earrings as a child. They like grew over the back, and like my body, anything that's new, it's like, we don't like this. So I knew that I would be one of those people. But I feel even 5 6 years ago, my girlfriend had to fly out of the country to a third world country to get her explants out, because no one here in Canada would listen, or do it properly as she had researched. So do you find like it is getting like exponentially
more and more as time goes on.
Absolutely. Yeah. And there's more and more surgeons that are focused solely on explant.
Yes.
So which is good that their surgeons are opening up to it. But I think when it does make the whole industry a little bit more complicated because now you have basically the same specialty operating on opposite sides of the same equation, right? So you've got plastic surgeons putting them in and plastic surgeons taking them out. And I just equate it like if we believe that this is a problem, it's kind of like
Why are we still
you've
creating it?
got two lung doctors
Yeah.
and on opposite sides of the smoking industry saying like, oh well, you can smoke, and the others are like,
Yes.
no, don't smoke. So it's like,
Yeah.
what's the
Yeah.
situation?
Yeah.
And surgery itself, you alluded to something before that I wanted to touch on,
Yes.
which is why I do surgeries a certain way, as minimally invasive as possible, but also to treat the surgical process as ceremony. Is that surgery is really traumatic. There's no question that even if it's done in the most um, clean, sterilized, protocol, safe way, that the process of surgery in and of itself is traumatizing. Your consciousness is being unplugged, you're being cut, and your body is internalizing and is going to have memory of that experience, whether it's through the scar that it forms or you know who knows the other things that are happening when you're unconscious. So I think that that process of surgery, in addition to what the implants are doing, is actually really is traumatic. And if you look at like a really holistic view of the whole perspective, and this is something I'm sharing, obviously not as somebody who's ever had breast implants, but just working
Fair.
in the patient community and just taking and putting all these stories together from my
Of course.
patients. Just trying to acknowledge the difference in privilege there. So this is information from my patient's perspective. Um, the original decision to have the implants put in comes from a place of most likely comes from a place of lack,
Mhm.
meaning there's I am not enough in a certain way, or this will help me in a given situation, like you yourself mentioned
Mhm.
in the fitness industry, like a
Yes.
lot of people get them, so there's something lacking there. So that's one thing. The second is then undergoing that actual traumatic experience of surgery,
Mhm.
even though it's done consciously with some amount of intention. And then after all that, having to experience, hopefully not, but if you do experience the symptoms of BI, which is like, oh, and now I'm sick from my implants. So it's like this negative feedback loop that
Yeah.
gets created and it gets stored in the body. So it starts from coming from a place of lack or insecurity that then gets validated and reinforced through a traumatic process of surgery, and then it just gets worse from a place where your body is now literally having a reaction to those implants. And so um, the reason I focus on surgery as ceremony is my hope is that it creates an opportunity to create not just healing for the body from that traumatic experience of surgery, but also for the psyche and the soul.
Mhm. Absolutely.
um, yeah, and the process of surgery as ceremony is one where patients are fully awake during the experience, and
That's so
they're
good.
so your consciousness is not being unplugged.
Yeah. Yeah.
It's done in as much as possible a pain-free way with certain medications that numb all the areas. It's not possible to always do breast explant surgery under local anesthesia, but this is more about the reconstruction of the breast with fat
Fair. Yeah.
afterwards. And it's sort of like a reclaiming of the self. It's like you are really a co-passenger, a co-pilot in this process.
Yes.
And some of the medications I use create this state of consciousness that is what I like to call neuroplastic. So you're in a state where you're really suggestible, impressionable, and together with therapists that I work with, and also this protocol that I've developed, patients can really undergo this transformation that like puts them back in the driver's seat, gives them
Yes.
the authority and sovereignty over their mind, body, and soul, whereas their past surgical journey may have completely disrupted that for them, whether it would it have been for implants,
Mhm.
the trauma of the surgery, or how they if they got sick afterwards. So it's like my attempt is to try and close that arc, and bring the patient back to the
Full
driver's seat
experience.
of their experience.
I would say that's kind of like in a like look back view of looking at like say having a baby at a hospital and having like a home birth, right? Where it's like, I'm not knocking any the hospital ones, but there's a lot of trauma, and childbirth is very beautiful and such a process, and like you said, ceremonial and intentions, and again, I've not had a baby and I've not had breast implants either, so I'm speaking out of my butt here, but when you look at both, it's kind of like you look at the nurses. I'm not saying nurses in hospitals don't fully do that, but they're so busy, right? So they have to flip through people. When you have that midwife or that doula at home that's focused, that's working you through things, and taking that traumatic quote unquote experience and like using it as power, and like it's not a negative experience, it's a transformational experience, and so therefore it's something that you want, and it's in line, as opposed to just very clinical, cut, dry, in out hospital trauma. And I think a lot of the medical industry think that's where they went wrong and turned it more into a corporate business, as opposed to like the healing portion of it. It's like, yeah, we got to make money, obviously, like shit, like do you know how much it is up here in Canada, like anyway, like we got to make money, but there's got to be a level too of making money, and getting out of touch with the healing aspect of it, right? And so a lot of the guests that we have on the show in the medical industry, why we love them so much, is the same thing. It's like, yes, there is risks, yes, this is traumatic, but let's make this experience, if that's what you want, as good as it possibly can be, so you can leave it feeling good. And I think that is very much missing right now. I don't think that Western medicine should go away or pharmaceuticals go away. I just think it needs to be brought back to like humanity and human, and the connections to who you are, instead of getting further away from that by being over medicated. I'm the same way now. Before I'd be like, yeah, just put me out. Now I'm like, I don't know about that. Like, just again, spirituality. It's like, do I want to be disconnected from myself? Sure. If it's a life threatening thing, absolutely. No question. My leg falls off. Yes. But do I need to do that? Do I really need to do that just to get a root canal? Like, you know what I mean? Or do I need a root canal? I won't go down that path, but you know what I mean? Like, so yeah, I think it's amazing to see individuals like yourself shift and go, hey, you know what? I'm aware of what this can do. And I'm going to tell you so you can make an informed decision, but I'm also going to make it as comfortable as possible, right? So that you're comfortable with that decision. And if you aren't after, because maybe you changed your mind, you didn't put yourself as much at risk by doing da 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 da. That's
And
incredible.
I just love your analogy of childbirth, because it is a really good similar analogy, um, and related point, where there's also just this experience that is so fundamental to the like um, to the human condition, like to go through the process of childbirth, where the sacredness of it and the ritual of it, I think, has been
Erased.
industrialized.
Yes,
Yeah,
100%.
it's been
Yep.
industrialized to the point where it's like what are we even doing? Like our bodies carry this innate intelligence that's
Yes.
just developed over thousands of years. And yes, we have science, and yes, we have incredible medical technologies that make it safer and make it possible for us to do things we could have never imagined. But let's not forget the sacredness of the rituals that brought us to the place. And
Yes.
I've got many friends that have done home birth, and hearing their experience has
It's
been
amazing.
transformative. Yeah,
Yes, I very rarely have heard a bad one. But if you, and
yeah,
like for myself, just like I can't have a baby, so I'll never most likely have that choice. So,
mm,
it's easy for me to say, like, yeah, I'll do a home birth. I know home
mm,
girl, it's hard, don't get me wrong. But I just think the support and the energy, and that it's all about you. And the beauty of it is that there is a hospital right there. You can call the
mm-hmm,
ambulance for when those, and I think just in society in general, we just try to avoid pain, which of course, but
mm,
to a degree where it's like, we're putting other things at risks, and we're giving up things and connections, and those moments that, are truly transformative as human beings, to try and avoid the uncomfortable. And I think all of us have been there and done certain things in our lives, whether that's through drugs or through
mm,
whatever, escaping at some point. And I think that as you age, maybe, or you go through your spiritual journey, you're like, no, that's the shit I gotta go through. And like, not like
mm-hmm,
I want hard things to come to me. I'm not saying that, universe, but I'm saying like when you go through it, you start to be like, okay, what can I learn from this? How can I grow? How can I be stronger? But I think when you're
mm-hmm,
so disconnected from that and yourself, you really struggle. So you do look for those alternatives because you just don't know yourself, and you don't. And so I think, like you said, people make these decisions like, I want breast implants. And then the implants are like, oh, I can get you in next week. You can put 5 grand down now and make payments for the next 6 years. It's like, oh shit, I gotta jump on it. And then they make that decision. And then all of a sudden they wake up from this unconscious experience going, what the fuck? And then if they're in pain, it's like an extra what the fuck. And I know so many of these women are like, this is not what I thought. This is not, because we're just so good at just going and being excited and goal oriented. And I want to do this and I don't have time. But sometimes giving it that time could save you a lot in the end, if that makes sense.
No, totally. I think I always encourage my patients to take as much time to think through and never rush into a procedure. It's never a good idea to just be fully rushing
Impulsive.
into something, especially something as serious as surgery. I mean, it's like it's a big deal. And just to go back to what you're saying before too, with the analogy of childbirth, like those things are just so sacred, and surgery itself is a process where for many people it's a once in a lifetime opportunity or experience, and why not treat it with as much reverence and sacredness as possible. And I remind myself all the time, even though this is something I do every day, multiple times a day, that often that is like a life defining peak moment for my patient. Like they will always remember the time that they had surgery. Some people have surgery more than once, um, but for many people, it's this very, very defining moment. So just treating it with a lot of reverence, care, and respect is really important.
And that, I feel like that's a huge thing too that's missing, is like that bedside like mannerism and patience, right? Like, and we've all been there. We've all been to that one dentist or that one nurse, and I get it. Like, but there's a difference of being tired at your job and just having a bad day and being short, to being like you hate what you're doing. And I think that happens when you're not in alignment. Like, it's, you want to help people, but that traditional medical space isn't for you. And I know a lot of women actually in my life, they're in the medical field, especially over the last couple of years, have been like, I don't know what to do because I have to go back to school to be able to make money, to be able to support my family, but I don't want to be a part of this like medical paradigm that they are currently having, And so there is actually there is nurses. We just had her on, a nurse from back east that is starting their whole kind of Canadian frontline nurses, and they're making their own platform so that people could go to them and start learning how to heal themselves, and then when you need them, then reach out, and then they'll help you and get you in touch with doctors that are aligned to how you are. So me personally, I struggle to go to the doctor right now because I've had so many problems in the past, and it's like, it sucks when that relationship gets cut out because it's an industry now and not about healthcare. But over the last couple of years, there has been this huge shift of everyone taking personal responsibility and being like, hey, the things that I'm doing, eating, is all contributing to my health. And then we have healthcare providers that are like, yeah, that's correct. And these are the ways that you can help yourself. But before, I noticed it was like, go in, I have like anxiety. Okay, here's some medication. Didn't ask me if I was sleeping, what I was eating, any of those things, right? So it's like, I don't know where I was going with that, but I'm just super excited that everything is coming back to actual patient care, actual trust in doctors, because like you said, you're putting them in the driver's seat with you. It's like, you have the knowledge, you're going through the experience. So together, let's move forward, instead of me just being like, hey, get in the back, here's what you need, goodbye, in the trunk, carry on. I don't know if that makes any sense, but I'm just really excited about it. And this is far more than I thought. I didn't even know that this even existed. So I was just like, I was like, oh, what am I going to ask him? Because, I'm going through this whole personal thing about like the beauty industry and the surgeries. And like you said, the money that's in it. And is this progression? Is this women empowerment? And I was like, oh, I hope but like, dude, you're so fucking aligned. Like, this is incredible. Just for those that are maybe looking to come to you for those types of services, or where would they go to specifically yourself? And is there anybody in Canada that does this kind of stuff, or do we have to come down to California?
Yeah, sure. First of all, thank you for your reflections and your kind words. And just to say, yeah, the medical industry is going to be constantly evolving, but I'm personally stoked that there's this what feels like a consumer or patient-centric push towards just optimizing and being in better health, and many doctors are following suit. So I think that's great. To find me or to reach out to me, easiest is probably through my Instagram, which is at drjon.k. That's drjon.k. I also can be contacted through my website, where I have some more information about the work that I do. It's Aura Aesthetica, and I can give you the contact there so you can share it. But that's AURA Aesthetica, AESTHITICA. It's auraesthetica.com. And yeah, I actually have a number of colleagues in Canada that do explant work. I trained in Canada. I trained at McGill University in Montreal, so I know a lot of the plastic surgeons there. I'm trying to think of one. There's one surgeon I know, and I'm blanking on his name right now.
Well, at least we can connect you to, like, if you're in
Yeah,
Canada and you're wanting to look, at least we have the connections to it.
it's so
It's
funny.
always what you need to
I'm seeing
remember.
his face, but I can't remember his name.
And you'll remember later when you're eating dinner, you're gonna be like, ha,
I
this
will.
is the name.
Oh, Nicolaitis. There you go. Stephen
Ah, there we go.
Nicolaitis. Yeah,
Perfect.
Dr. Stephen Nicolaitis. As far as I know, he does a lot of explant surgery. Um, but there are some other ones that are working on it as well. And there's
Perfect.
actually um, there's a nurse that I've been in contact with from Montreal too that also does a lot of patient support and works with patients in that industry.
Amazing. It's starting to leak
Yeah.
up here, guys. We don't have to. We're always so behind in the States.
Yeah.
Always.
Well,
Everyone thinks we're like
it's
way ahead.
yeah. I mean, Canada. I trained in Canada. Canada, I would say, is very progressive in a lot of ways, just in general about
Yes.
patient care. I would say one of the bigger challenges is that the insurance industry hasn't caught up with reimbursement
No.
yet and
And
made it more of a
that's
thing. And
yes.
it's a challenging thing just because it kind of blends with the aesthetic space, which is
Mhm.
always a challenge for insurance companies. But
Yes.
I mean, I personally believe BI is a valid medical diagnosis and deserves to be cared for and treated like any other illness. So,
Yes. And for
yeah.
whatever reason you got it, I don't think it should really matter, especially like when there hasn't been this much like how can you blame it on the patients when there hasn't been a true informed consent over quite a few years, right? Like
Yeah.
this is where I kind of struggle too. And that's why I have so many women, some right here in Kelowna with me that always tell me, and I share stuff and they always feel like shit when I share stuff because I know they want their explants, but they're like, I'm
Mm,
a single mom. I can't afford this 10, 15, $20,000. I can't
mm,
afford to be off work. And this is the position. And this is why I speak out about it because it's like, my thing is like, if you're going to get them, research who you're getting them from. And also, I think, and maybe I'm crazy, if you're going to have the money to implant them, you should also make sure you have the money to explant them if possible, because then if something does happen, then you can be more reactive instead of being trapped. I think I
that's
know
a
that's a
great point.
ridiculous amount of
Yeah.
money, but if you know the risks and like if it was me, I would have to because I would know, like I said, my earrings like grew over when I was a child. Like I wear like a ring and I'm eczema like right away. I'm just very
Wow.
sensitive individual. So I just know if I put that inside, it's probably not going to react well. So I've
Right.
never done it. So I
Yeah.
don't do Botox or fillers or any of that because I'm in these support groups and I see all these women that, had no idea what Botox and fillers can do, no idea what breast
Mm.
implants can do. Hey, you're going to be able to have these for 20 years. We can run them over with a car. Well,
Oh my God, I personally, you said something that just triggers me a lot.
sorry.
I know it's in a way I want to talk about it. Like I
Yes, please.
cannot stand those. I don't know if you've seen them, but like many plastic surgeons I know, they'll like do these videos where they run an implant over or they stab it with something. I'm like,
There's
oh,
nothing
that
going.
is just it's just not. It's like put it in a warm bag for 20 years and see what happens to
Yes,
it. Like that's it's
exactly.
not going to make a great TikTok video, but that's
No,
more
no, no.
likely reflective
It's
of
not
what's
gonna
actually
trend.
happening.
Yes.
And I
And
just
that's my
I
problem. I wouldn't
yeah.
care so much. I wouldn't have such beef if they were like, "Hey, this is what like with the mold in it, like this is a potential in 10 years. And if you do this, so many women are told that they can have this for the rest of their lives, that they won't ever have to do
Mhm.
these surgeries again." It's like,
Mhm.
"No, I'm pretty sure you should just like with a car, you replace things in your vehicle when it breaks down it and
Mm.
it's not for any individual to know. To me, that's why you go to a professional. So,
Mhm.
there is patient accountability. People do need to research who they're going to for sure. I'm full of tattoos. I made sure that the person that was putting this permanent stuff on me was going to be good. Looking
Mhm.
back now, I was like, did not know how toxic tattoos are, but we learned we're not finishing our leg sleeve probably now, but it's all as
Yeah.
you go through stuff, right? And so it's never about shame of getting these things. I'm the same way. I got a whole entire sleeve and half my leg because obviously I wasn't fully happy with my body and I wanted to do something different and I didn't know the risks and I just went and did it. And like that sucks, but now I know. So now I'm going to be very selective on if I do or who's going to be doing it and what material I'm going to be doing it with, if I'll even do
Mhm.
it. There's no shame in these decisions that we all made because we didn't feel good. And I think that's the
Mhm.
hardest part. It's the hardest part talking out is because you don't want someone to feel shamed. You don't want them to feel bad because we're all fucking there in any ways. Some people have body dysmorphia, some people have face dysmorphia, some people have imposter syndrome like me on this podcast every goddamn day.
You're
So
crushing it.
it's thank you. It's not it's not for shame. It's more like, I just don't want people to hurt, and I don't want people to sit there and think that it's their fault and that something's wrong with them or that they should feel shamed. And I want there to be insurance. You pay for your insurance. You should be able to fucking decide where the money goes. Don't get me started on benefits. But
Mm-hmm.
like, to sit there and tell a woman that she doesn't deserve to have insurance benefits because she had an insecurity and made a decision at 19 years old, and as a mom of 32 she's sick and she shouldn't get any help, I think that's just such a backwards thing to do. But you're shamed for talking about that, and a woman hater and a misogynist and all those things. And it's like, but sweetie, I'm not. Like, I'm so far from that. Like, I have to live with these things in my head. I know that getting explants are bad. Doesn't mean I don't sit there and think about it. Doesn't mean I don't sit there and go, well, like, it's a lifelong battle that we all have to go through, but there's no shame in it. And that's why
Mm-hmm.
I want to have people on the show that are experts, or even just that have gone through it, so that you feel safe, so you don't have to sit there and go, no one can figure out why I have anxiety. Maybe it's your boobs. I'm not saying it is. Could be in a stressful
Mm-hmm.
life. You could be eating a lot of bad shit. You could be doing bad stuff too, but nothing else points to it. Why can't we look at that avenue without being considered a bully, or anti-feminist? Like, I'm not a feminist. I'm a middle person. I'm a human person, right? And I hate the attack. So, like, honestly, thank you so much for even putting this on our platform, that this is possible. But before we do go jump off today, though, can you explain a little bit more of the surgeries that you do? Like, how does
Sure.
that exactly work? Because now I'm like, not saying I'm coming down to visit, maybe to visit, but I'm very curious because I had no idea that was even an option.
Yeah. So the specific surgery that I do is called fat transfer to the breast. So it's taking fat from one part of the body, processing the fat, and then using the fat as a sculpting, as the medium to either reconstruct or augment the shape of the breast. Fat grafting has been around for a long time. It's been around for 30, 40 years or so.
Mhm.
The technology around it hasn't changed that much. It's improved a little bit here and there. But what I've done in my practice, I've developed a certain way that I process and use the fat to increase the amount that survives. So when you transfer fat, it's kind of like planting seeds in the garden. If you just take a handful of seeds and throw them in the grass, not all of them are going to grow. And it's the same thing
Yeah.
with fat. About 50 to 80% of the fat will survive.
Cool.
In my practice, I've adjusted the technique a little bit, so I think it's probably closer to the 70 to 90% range.
Nice.
And
Wow.
so the way I do the procedure is that patients generally, depending on their preference, are awake. Like I mentioned before, with the surgery ceremony process, they're fully awake. They meet with myself as well as a psychotherapist that I work with to help sort of prepare and guide them for the process. I use a medication called ketamine.
Okay.
Ketamine is a powerful anesthetic that helps prepare not just the body, but also the mind for surgery. And so before surgery, there's a usually one ketamine session with a therapist to kind of prepare them for the process of being awake during surgery and this transformation. And then on the day of surgery, I use ketamine as the anesthetic, which is it's been used as an anesthetic for a long time, but I don't think it's been used with this kind of intention, which is
Cool.
to help the mind and body transform. And so on the day of or during the procedure, the way the surgery works is I numb all of the areas with the special tools that I have, and then I remove the fat very gently from different parts of the body. So some people like that because it's you get
Yeah.
to kind of
Kind of two for
adjust
one.
yeah, well you sculpt part of the body and then you get to use that fat as a medium for somewhere else, and then the fat gets inserted and I'm literally sculpting with it. So I'm putting in like little tiny droplets of fat throughout the breast,
Cool.
and that shapes and sculpts the breast.
Yep. Wow.
And I think it's a more anatomic or more sort of like appropriate, if you will, a way to do this procedure because most of the breast tissue is actually fat. It's a mixture of fat and
Mhm.
gland. And so by putting fat tissue there, it just creates a more natural aesthetic result. And it does not look like implants. It doesn't, the goal
Mhm.
isn't to look like really sort of large or artificial. It's about enhancing the natural shape that you have. And so
That's
I
cool.
do this, and so then after the surgery, um, I have a whole recovery protocol that patients go through with a body lymphatic worker to help the recovery process, and then they're always welcome to meet with the therapist again to kind of complete the transformation.
Mm. And it's
Patients
like
go
a
home
whole
as
thing.
Yeah, the whole thing. Yeah.
Yeah,
Yeah, I'm giving you the A to Z.
the
So
whole
they go home.
package.
Yeah, they go home the same day of surgery, and because you're awake and not asleep during the procedure, the recovery is meant to be a lot easier. You don't have to recover from general anesthesia. It's only you're not meant to be bedbound at all. I want you moving around and walking basically the same day of surgery. So it's meant to be like a much smoother recovery process. But to answer your question, just make sure I answer
Second.
it. Specifically it's the fat transfer that I focus on.
Okay.
So fat transfer to the breast. So taking fat from one part of the body and putting it into the breast.
And then because the breast's already used to that and it's your own body, I imagine it's much more accepting to it than, a foreign object. So it's not like, hey, what the hell is this? It's like, oh, hey, this is here. And it's like, oh, okay. Just
Yeah,
kind of gets
well,
used to it.
and totally. And I keep everything in a closed container, which means I don't
Mhm.
add any kind of foreign body or there's no artificial, there's nothing. It's like the way I process the fat, I keep it all fully closed and sterile. So it's literally coming out of the body, staying in the closed container, and then going back into the
Going
body.
back in.
So there's no real foreign body reaction.
Mhm.
There is always a possibility that some scar tissue will develop just because anytime you do any surgery anywhere in the body, there's going to be some scar tissue, but it's not
Yeah,
scar tissue that's in reaction to a foreign
that's
material or
amazing.
anything like that. And then
Yeah.
usually most of it resolves and heals. And I've been following patients for almost 5, 6 years now after their surgeries, and they're doing great.
Ah, that is so amazing.
Yeah,
Well, this is
yeah,
awesome. This is far more than I'm not saying I'm coming down and book an appointment. I'm just saying that it's really exciting that, like you said, and we've had, like, I'm sure Robin, Town, I'm always terrible with
yeah.
her last
She's
name.
great.
Yes. Amazing woman. She had double mastectomy and got attacked right away to get breast implants. And she will say that it was worse having the implants than her cancer, which when she said that, I just kind of blew my mind that she was like one of the first people I interviewed too.
Yeah.
And she's been on several times on our show, and she's doing amazing things. But it was just incredible to hear her say that, because in your mind you're like, how can anything be worse than like cancer in that mind, right? And it's so amazing that these women that have gone through so much, that are going through this, can come to you and have, because a lot of them are looking for more of a natural way of embracing their body, right? And I think that this is an amazing way that, again, it's that blend of both worlds, where it's like, absolutely, if there's something that's really bothering you, especially medically or aesthetically, and it is literally hurting your life, you absolutely can do whatever you need to do, as long as you are comfortable with the risks. And to know that you can do this without having the major risks that we're seeing with breast implant illness or just the surgeries in general, is just so amazing. Thank you, Dr. K, for just being that person, for continuing doing this, for coming on our show. I'm going to probably twist your arm to come back on in season 6, and maybe we can get more like into the sciencey part of it, because I like to learn and I'm kind of nerdy like that, even though I can't say the words. I definitely like to learn. So thank you very much for joining me today. Guys, make sure you're following Dr. K on Instagram. Go to his website. We will provide all the information in the posts. But yeah, I hope you have a great rest of your day. Thank you again. And you guys, until next time, bye.
Thank you.
Thank you guys so much for stopping by the show today. We truly hope that you had a good time. If you liked this episode and you want to hear more, make sure to subscribe to our channels, like our episodes, and turn on those notification bells. You can find us on Rumble, YouTube, Spotify, Anchor, Apple, and Google Podcast. You can also find us on Instagram, Facebook, and Pinterest. Until next time, guys.